Thank you very much, Madam President. Let me join the Democratic leader in expressing my dismay.
The Senate will be in order. Senator from Rhode Island.
Thank you, Madam President. Again, let me join the Democratic leader in expressing my dismay on what has been going on the Senate floor this week with respect to health care. For over 7 years, my colleagues on the other side of the aisle have been talking about how they intend to repeal the Affordable Care Act in order to replace it with something better and improve our health care system. President Trump has said time and time again that he would provide better health care at lower cost. He said that everyone would be covered. Yet we've seen no solutions from the other side that would accomplish these goals. We have been trying to work with Republicans, not just this year, but for the last several years, to improve our health care system. In fact, we worked with them to craft the Affordable Care Act in the first place, holding public hearings and meetings with both Democrats and Republicans around the table. And the Affordable Care Act included well over 150 Republican amendments. Yet they refused to work with us on our final passage of the law and refused to work with us on the current law and health care ever since. However, last night and today, we have seen a couple of glimpses of bipartisanship. First, the Senate voted last night, both Democrats and Republicans, to reject the Trump Care bill that would have provided tax breaks to special interests while decimating Medicaid. And I am glad that the Senate has spoken on that issue and said that we do not support this effort. Then this afternoon, Democrats and Republicans voted to reject a bill that would have repealed the Affordable Care Act with no replacement. A majority of senators voted to say that effort was unacceptable. Now that we've taken those votes, senators have had their say on what they think is the best path forward. And to me, these votes show that most senators want to work in a bipartisan fashion to improve our health care system. I've heard many of my colleagues on the other side of the aisle say just that, like Senator McCain said so eloquently yesterday. I think if my colleagues were willing to sit down and negotiate in good faith on legislation to improve our health care system and bring down cost, we could come up with a bill that would get the support of a majority of this body. My colleague, Senator Shaheen, for example, has introduced legislation to help stabilize the individual market, something I think most of us would agree is an important step forward in improving the Affordable Care Act. However, we are now hurtling towards a vote with absolutely no plan to improve the health care system. My Republican colleagues are scrambling to get enough votes just to pass anything at all. Right now, we are debating the bill, but what does that mean when we have not yet seen the bill we're eventually going to vote on? This is not a meaningful exercise with opportunities to amend and improve legislation. We are simply killing time so that the Republican leadership can unveil a new bill, if they are able to come up with one, that they convince enough of their members to support. Hours or even minutes before final passage, this could be sprung upon us, and we would then be forced to take a vote. That is not the way the legislative process should work. And what kind of message does this send to our constituents? This is an example of legislating at its worst. This is why many Americans don't trust Washington to have their backs. We don't know what Republicans intend to pass at the end of this debate, but we do know that they intend to pass something that is harmful. The CBO score, which the Democratic leader suggested, based upon the reports of what is pending, suggests significant losses in coverage across the country and significant increases in the cost of health care insurance for Americans. And based on what we've seen so far, each proposal would send the health care markets into a death spiral, impacting all of our constituents, not just the Medicaid recipients, not just those that are in the exchanges, even private employers who provide insurance coverage for their workers would see increases. And as I mentioned earlier, the bill we voted on this afternoon would repeal the Affordable Care Act with no replacement. In that case, the Nonpartisan Congressional Budget Office has said that this would cost 32 million Americans to lose health insurance over the next decade, including 17 million next year alone, and health insurance markets would collapse. As I indicated, fortunately, that vote failed with both Democratic and Republicans voting against it. But it looks like Senate Republican leadership is still trying to cobble together yet another version, taking some of the worst elements of the repeal effort. What's worse is that there will be no opportunity to review the bill, no chance for CBO to analyze the bill and provide feedback, no opportunity for stakeholders, patients, and states to weigh in. It is telling that the only path forward they have to pass their repeal effort is to pass a bill that no one has literally read. The only chance they have to get support for their effort is to hide, essentially, the impact of the bill, because on the merits, it appears devastating to our constituents. Nevertheless, as much as they try to hide this bill, the American people will find out. They will find out when they get the bill for their health insurance. They will find out when they go to the doctor and discover the treatment that they had last year that was covered under the Affordable Care Act is no longer covered. They will find out when the only insurance company in their state decides to leave. They will find out when their employer says we are no longer providing health care to employees. They will find out when they start a family and discover that maternity care is no longer covered. And if the child needs medical care early on in life, the insurance company may say, no, thank you. We don't have to cover the child. There is a pre-existing condition. Just last night, I got a call from a woman in Charlestown, Rhode Island, Amy. She urged me to continue fighting to preserve the Affordable Care Act. She is a hairdresser, and her husband is a commercial fisherman. Because they are both self-employed, they are not able to get coverage through work. They have been able to access care through our state's health insurance marketplace, HealthSource Rhode Island. As Amy said, she and her husband are hardworking, middle-income taxpayers, but they never have been able to afford coverage without the help of the Affordable Care Act. They would not have been able to do that. Amy recently got sick and had to be hospitalized. She has coverage because of Obamacare and was able to get the treatment that she needed. But without coverage, she would have been left to pay a bill of $78,000. Amy told me that she and her husband would have had to sell the house to afford that, and probably, even with that, they would have been left impoverished. Is that really what my colleagues want for their constituents? My constituents know what's at stake. I've heard from thousands and thousands of them throughout the year urging me to keep fighting for their health care, asking me to try to put an end to this repeal effort. However, Democrats cannot do this alone. We need more Republicans, like some of my colleagues, Senator Collins and Murkowski, to come forward and say, enough is enough. Even if you have problems with the current system, let's try to work together to solve the problems. We might not always agree, but we'll try our best to come to a consensus. There is no harm in trying to come up with a bipartisan solution. It is not too late to reverse course and return to regular order, to start again, to start right, to do it, as my colleague on the Armed Services Committee, the Chairman McCain said, the good old-fashioned way. Senator Alexander and Senator Murray and the Health Committee, my colleagues on the Finance Committee, working their way through carefully, deliberately, listening, amending, moving forward legislation so that we can come to this body, not with a few minutes' notice, but fully prepared to vote on something that is critical to every family in the country. And with that, Madam President, I would yield the floor.